As we get older, a lot of things slow down: metabolism, memory, the ability to get up from a chair without making a sound effect. Unfortunately, one of the things that also slows down without much fanfare is zinc absorption. That's right. While you're busy worrying about joint pain and crossword puzzles, your gut is quietly forgetting how to extract enough zinc from your food. And that's a problem, because if there's one time in life when you really need zinc, it's later adulthood. Zinc isn't just a minor mineral with a small supporting role. For older adults, it's more like a life support technician, essential for keeping the immune system alert, the brain functional, and the body from crumbling under the weight of accumulated wear and tear. But due to changes in digestion, reduced stomach acid, medications like diuretics or antacids, and often smaller or more restricted diets, the elderly are some of the most likely to be deficient in zinc, even while needing it more than ever. That's a cruel biological joke if there ever was one. Let's start with immunity, because no one enjoys being sick at 25, and certainly not at 75. Zinc is one of the most important nutrients for immune resilience, especially in aging populations. It helps produce and activate T cells, boosts macrophage activity, those are the little immune Pac-Men, and reduces the inflammatory chaos that can make infections more severe. Older adults often have a slower or blunted immune response, a phenomenon charmingly called immunosenescence, and low zinc only makes it worse. Supplementation in elderly populations has been shown to reduce the duration and severity of respiratory infections, and in some studies, even reduce hospital visits and complications. That's not just a health improvement. In the world of senior care, that's potentially life-saving. But it's not just about the sniffles and fevers. Zinc also has a quiet but critical role in preventing frailty, that slow, creeping syndrome of muscle loss, weakness, and vulnerability that affects so many older adults. Zinc helps maintain protein synthesis, supports appetite, and contributes to wound healing and tissue repair. It's involved in muscle regeneration and energy metabolism, and when it's missing, the entire system starts to sputter. There's growing evidence that low zinc status correlates with physical decline, slower recovery from illness, and even increased risk of falls and fractures. In other words, low zinc doesn't just make you more likely to get sick, it makes you slower to bounce back. And then, of course, there's the brain, that mysterious organ that many of us hope to keep sharp long after we stop remembering where we left the remote. Zinc supports synaptic plasticity, modulates neurotransmitters, and acts as a neuroprotectant against inflammation and oxidative stress. Deficiencies in older adults have been linked with higher risks of depression, cognitive decline, and Alzheimer's progression. No, zinc won't turn you into a chess champion overnight, but it might help you remember why you walked into the kitchen in the first place. The irony is that the foods highest in zinc, like oysters, red meat, or liver, often get phased out of senior diets. Whether it's dental issues, digestion, budget, or just a preference for blander meals, many older people unintentionally drift toward diets lower in zinc-rich foods. And with reduced absorption in the gut, even normal intake levels often aren't enough. The good news? This is one of the easiest biological oversights to fix. Supplementation with low-dose zinc, usually around 15 to 30 milligrams per day, depending on the individual and dietary intake, has been shown to improve immune parameters, reduce infection risk, and even improve mental alertness. It's not a magic bullet, but it's close to a mineral seatbelt, quietly protecting, stabilizing, and supporting the aging body in dozens of unseen ways. So, if you're older or care for someone who is, zinc should be on the radar, right up there with vitamin D and calcium. It may not come with glowing marketing or a glamorous reputation, but it might just be one of the most overlooked nutritional lifelines in the entire aging process. Your immune system, your muscles, and your brain will thank you quietly, efficiently, and with significantly fewer sick days.